Okay, well, those were all the headlines. We've been speaking to a lot of hospitals and, of course, pharmaceutical companies to just get a sense on how all this is playing out for business and what steps are being taken to perhaps, try and fight this crisis. We have Mr. Ajaikumar of Healthcare Global now joining in. Now, Healthcare Global, of course, has a big presence in the cancer care segment. So let's try and get more details. Mr. Kumar, thanks for joining in. Now, I just want to understand how you are placed vis-a-vis the COVID crisis, because you're in oncology, which is a different section. So has there been any tweak in the kind of patients that you've been taking in, and how are your emergency teams positioned in coping up?
Yeah. So far, we have not had any positive cases, which is good. But where we had a issue is the number of patients coming, new patients. There has been a drop because of all the lockdown and the concern the patients are having, particularly those who have to come from distance, transportation, practical issues are coming in the way. But those who are on treatment are continuing. We have taken all the necessary precautions for safety of the patients and the staff. One positive thing is being in oncology, we deal with a lot of infections. And because of that, we are ever ready for managing infections, not only patients but staff. So because of that, our preparedness has been good. And fortunately, as I said, not a single case has been recorded in our entire 23 hospitals across India, which is very good. So far, so good. But the only issue has been obviously, when a patient has a pain or abdominal pain or a mass, they will delay going to the doctor. So my concern is it will delay the cancer diagnosis. So the patients may end up coming in a later stage than early stage because of this lockdown and the apprehension in the public about the virus. So what we have to see in future is whether we'll start seeing more number of advanced cases of cancer rather than early cases because of this delay. But that is a concern we have. And also, obviously, the patients, will like to wait till the macro environment improves before going to the doctor. So there is nothing like here it is not a elective surgery. There is nothing like elective surgery. There's nothing like elective treatment. When you treat a cancer patients, we have checked the global cancer hospitals treatment, including the American Oncology Society and all. All are recommending the cancer patients should not be denied any treatment. Cancer patients should not fear, but they should come for the right treatment at the right time. And we have to make sure the government and the private enterprise make sure the transportation system, everything is done properly. So we have created hotlines. We have created lines where people could call and get information, a national hotline. Through that, they can ask questions about the COVID virus. They can ask questions about cancer and decide where they should go based on the symptoms.
Sure. Totally take your point, sir, and I think that would be serious collateral damage if we start having, cancer getting detected later just because people are hesitant to come into the hospitals right now. If you could just give us some more color in terms of your outpatient department, to what extent have footfalls reduced? If you could give us, maybe a percentage between March and let's say the previous month. And similarly, what is the kind of drop in occupancy that you have noticed so far about 3 weeks into this situation?
We have seen after 15th of March, we have seen a drop in the number of new patients coming. Initially, it was about 20 to 30%. That is what we are beginning to see. There was, of course, yesterday was a holiday in certain parts of the state because of the festival. But short of that, we are seeing about 25 to 30% drop in the new patient registration. But those patients who are already coming, fortunately, we have not seen a significant drop in the radiation patients, not a significant drop in the medical oncology. The follow-up patients have dropped almost 40%. Follow-up, those who come for follow-up. Surgical patients have dropped by about 20%.
All right, Mr. Ajaikumar, you own around 39% stake in Strand Life Sciences, and they are one of the approved laboratories to go ahead and test COVID-19. So have you all started testing already? I mean, this particular, company that's a Strand Life Sciences where you have nearly 39.
We have got the approval just few days back. A validation process is going on.
Okay.
And I think kits are going to be supplied from the last discussion I had with the Strand's CEO. I think in the next 5 days,
Okay.
we should be ready to start testing the patients.
Okay, and it'll be priced at around 4,500 rupees.
Yeah. And we will also, we will obviously not deny for anyone.
Okay.
If somebody needs it for free, we will certainly do it. It's a social call, and we cannot say no to anyone. So we are determined to get rid of this disease, and whatever it takes, we have to do. And doing more tests definitely is positive.
Yes.
One of the concern globally about India is that we are not doing any tests.
Okay.
Number of tests. So we should do to get the right number and compare ourselves with the global. Hopefully, it will be far less than the global phenomenon.
Absolutely, full power to you and all the best in this. But if you could give us a few numbers, potentially, how many tests will you be able to do on a daily basis? Do you have some rough numbers?
We can, from my understanding, easily 15 to 20 we should do, depending on the kits availability.
15 to 20.
PCR method.
Okay.
And as the kits number come, we can do hundreds. I don't think that will be a problem.
Okay.
And we all should come together. Our doctors, scientists are all working very hard.
Right.
To day and night, not fearing the disease.
Yes.
So hopefully, as a nation coming together, we can achieve the goal of defeating this problem.
Absolutely, we'll come together. We'll unite as a nation, and we'll unite, and defeat this epidemic that's hit us all of a sudden. But if you could give us a sense in terms of business, how many of your patients come from overseas? Transportation is shut in terms of international flights, so that would have some impact if you do have a sizable contribution from there.
It is definitely going to have an impact. In that, I included, when I showed the numbers, I included that.
Yeah.
Overall, at an enterprise level, is 5% of the revenue is generated from international patients. But in places like Bangalore, Mumbai, obviously it's high. Bangalore is about over 15%. And Mumbai is about close to 15%. So big cities are affected more, but when you average it out across India, it will be 5%.
Okay, all right, Mr. Ajaikumar. Wishing you all the best as you undertake this mission, and hopefully, in fact, we'll be able to combat this deadly virus sooner rather than later. But all eyes now going back to the markets ahead of the Finance Minister's press conference, which is scheduled at around 1 p.m. today. We spoke to a lot of experts, and let's hear out some of them, what they had to tell us earlier.
Whatever we do has to be to size and scale, and that it should make a big impact as far as, because several sectors have got impacted, workers have got impacted, daily wage earners in urban areas have got impacted, large companies have been impacted, and therefore we need to look at a comprehensive package for the country.
The biggest priority is to deal with the health side of the crisis. And if that requires expenditure of various kinds, which it certainly will, I think that ought to have top priority. We should not be worried too much about what that might do to the fiscal deficit, because quite honestly, the fiscal deficit is going to be seriously destabilized because of the expected collapse in growth all over the world, which will also happen in India. An aspect that you have to keep in mind here is that the expenditure has to be done by the state governments. I mean, it's going to be expenditure in hospitals run by state governments. So probably the central government will have to introduce some new centrally sponsored scheme which is fast disbursing, where state governments can get on with doing what's needed.
There's a good package from the government, given the fact that the impact of this virus and lockdown is very, very severe on many segments of the economy. And obviously, they need government as well as RBI need to put together a package which can make sure that the economy also revives. That only can sustain the market rally.
And I do not even think that thinking out of the box by the RBI is going to help. RBI, like every other central bank, will need to do things that are unimaginable. Unimaginable in the sense that we would never expect the central bank to do. The Fed has already done that. Fed going into the primary market to buy corporate bonds was something that, we would never imagine that a central bank would do. I think the RBI will need to do that. And I think the RBI will need to do these unimaginable things because, in the first place, it is inheriting a financial system, financial market that has already been clogged up with serious illiquidity problems, both in the banking sector as well as in the non-banking sector.
Okay, well, those are views coming in on the impact this crisis is having on various sectors. We'll take a break on that note. On the other side, we will get you the commodity market action of the day. Dharmesh Bhatia is going to be joining in along with Manisha Gupta.